Hello and welcome to the Patient Education series. My name is Christian, I'm an optometrist, and the aim of this series is to provide some information in plain English to those who want to know more about common eye conditions. Perhaps you've been told that you have cataract, glaucoma, or macular degeneration, and you're not quite sure what that means. Or perhaps you want to support a relative or friend. My hope is that after watching these short videos you'll have a clearer understanding of various eye conditions and I'll offer some helpful tips to support you. I welcome your suggestions for any topics you'd like me to cover in the future. And if you find this video helpful, please subscribe so that you're kept up to date as new videos are released. Welcome to the Patient Education series. Today we're going to be talking about glaucoma and an associated condition, ocular hypertension. In a nutshell, ocular hypertension is where the pressure inside the eye becomes raised, not related to blood pressure. Glaucoma, on the other hand, goes a step further than that. Usually the pressure is raised and that in turn causes damage to the optic nerve at the back of the eye. As the optic nerve becomes damaged, your visual field constricts, and unfortunately once you've lost some of your field of vision you can't get it back again, so it can be difficult to navigate around and do your normal daily activities. For those who want to know a bit more about glaucoma and ocular hypertension, I'm now going to go into that in a bit more detail. So as I mentioned, glaucoma is damage to the optic nerve, and as a result of that the effect is loss of the visual field, or your field of vision if you prefer. Let's start off with some basic eye anatomy. This is the eyeball here, this is the front of the eye, and this is inside the eye. And in glaucoma we're particularly interested here in the optic nerve. The optic nerve is what connects the eye and the brain together. If we look face on at the optic nerve, which we can see here, you may be able to see all these little tiny lines which are all pointing in towards the optic nerve. And these are actually about 1 or 1.5 million little nerve fibres which collect information from whatever it is you're looking at, and it takes that information down the optic nerve so that the brain can interpret it. And it's these little nerve fibres as they enter the optic nerve that get damaged. So the problem in glaucoma is the visual field loss. This is a gradual process, it's a painless process, but more importantly it's an irreversible process. Once you've lost some of your field of vision, you can't get that back again, and that can really affect your ability to do day-to-day tasks. So one of the key objectives in managing glaucoma is to try to preserve that field of vision. We measure the field of vision with a machine like this, a visual field analyzer. You've probably seen one of these before. Little lights flash on the screen and you push a button when you see one. And if we look down this series here, what you'll notice is this is quite a light grey colour, but as you move down you see more and more of this grey and black stuff appearing. And this is parts of the field of vision which aren't working now as well as they were. So this is visual field loss. And alongside that you'll see how this is starting to creep in to what this patient can actually see when they're looking at a fruit and vegetable stall. So in the context of glaucoma we often talk about eye pressure. The correct term for that is the intraocular pressure, or IOP. Intra means inside, so it's the pressure inside the eye. And we measure that either with a puff of air, which you probably had done in your optician's practice, or you may have had the blue light test where we measure the pressure a bit more accurately and directly with a slightly different machine. Now all eyes have a pressure inside them, that's normal, and the reason we have a pressure inside the eye is because there's a watery fluid which is produced inside the eye. That's nothing to do with your tears outside your eye. So a watery fluid is produced and it drains through little drainage channels at the front of the eye. If those drainage channels become blocked, then that watery fluid can build up a bit and then you start to get an increase in your eye pressure. Now in some people that doesn't cause any problems at all, that's just called ocular hypertension. But it does put you at an increased risk of getting damage in the future, so your risk of glaucoma, which is the damage aspect, is increased. Interestingly, there's a separate group called normal tension glaucoma, where the pressure is completely normal, but they still get glaucoma damage. And this is probably because the optic nerve is a bit weak, or perhaps their circulation is not so good, so it's different reasons. We also carefully check the drainage channels themselves using a special lens called a gonio lens, which you can just see here. And we're actually looking at the drains which are in this part of the eye near the front here. This helps us to decide if you have a type of open angle glaucoma, where the drains are wide open, or a type of angle closure or narrow angle glaucoma, where the drains are more narrow. So why do people actually get glaucoma, and what puts people at an increased risk of glaucoma? Well, age unfortunately is a risk factor for glaucoma. Most people with this condition are over 60, many of them are over 80. If you have a family history of glaucoma, so this is a first degree relative, which means your parents, your siblings and your children, your risk is higher, and you should be having a yearly sight test with your optometrist to check for your risk of glaucoma. If you have strong glasses power, whether you're long-sighted or short-sighted, then either way your risk of glaucoma can be higher. People who take steroids, whether they're oral steroids, tablets that you eat, or steroid inhaler, or even steroid eye drops, can have an increased eye pressure and therefore an increased risk of glaucoma. There are certain racial risk factors, and those, as I mentioned earlier, with poor circulation are probably at an increased risk of glaucoma. To finish off, let's talk a bit about the treatment options. Whether you have ocular hypertension or glaucoma, the aim is to reduce the eye pressure, because that in turn will either reduce the risk of you getting glaucoma, or if you've already got glaucoma, it will slow down the rate of progression of that glaucoma, so it will help to preserve your field of vision. And there's two ways we can go about doing this. Remember, the pressure in the eye is there because there's a watery fluid which is produced and drains away. So if less watery fluid can be produced, then the pressure is going to go down. And similarly, if we can improve the drainage out of the eye, the pressure is going to come down. So you can see those two options here. Less fluid coming in and more fluid draining out. And there's three ways we can do that. The commonest one is eye drops. And the eye drops actually can do either of these. They can reduce the rate of the fluid being produced, and they can help to increase the rate of the fluid draining out. The main thing with eye drops is to remember to put them in when you're supposed to. And when you do put the drop in, it can be helpful just to pinch in the corner here, even just for 15 or 20 seconds, because there's different drains outside the eye. When you put the drop in, the drop will run away through that drain. So by pinching it, it'll stay in contact with your eye for a bit longer, and it may well have a slightly better effect. But your eye drop technique is really important. The second option is laser treatment, and laser is gaining more popularity now, and that's actually increasing the hospital waiting times. But in essence, the purpose of laser, almost all types of laser, is to increase the rate of drainage, so that it's helping the fluid to drain out more efficiently, usually by making little holes or tickling the drains. And the final option is surgery, and surgery is usually only used as a last resort, so where the drops and the laser aren't having such a good effect, or perhaps the glaucoma is just not very well controlled, then there's a type of operation that you can have which will actually help to increase the fluid draining out of the eye. Thank you for joining us, and I hope you found that talk on glaucoma and ocular hypertension, raised eye pressure, to be helpful. Thank you.